Hi everyone, it's Kara with, I'm one of your admins here at Preeclampsia, Eclampsia, and Help Syndrome Survivors Facebook group. I'm gonna give a few minutes so everybody can get, who happens to be online can get logged in and start watching the Facebook Live here. I'm popping in today mostly because we're gonna try to start doing more Facebook Live sessions. It's nice to put a face with a name and also do some interactive question and answer. It's nice to get a live answer. I know sometimes you post questions and it takes a while for us to get around to approving those questions. A lot of times it's because they are complicated questions and we're looking for correct answers, right answers for you. And so sometimes we have to do some research before we can approve your question and get back to you with a good answer. I want to, hi Brooke, hi Laura, hi Jennifer. Thanks for joining. Alexis, I see you as well. So just to start, I want to remind everyone that I'm not a doctor or a nurse or a healthcare provider. I am a preeclampsia educator and advocate and have been volunteering, I guess, in those capacities for about 12 years now. We are an evidence-based, science-based group, and the answers that we give you are based on research that we do. Not that we do, but that we read. And sometimes the research we don't even understand. And so we have to seek professionals to help us understand that research before we bring it back to you. Hi, Jennifer. Jennifer CG, we call you Jennifer CG if we're talking about your questions. We have a lot of Jennifers just in the moderating team alone. We have three or four Jennifers. So hello, Jennifer. So I'm going to start doing a series called, and I have notes here to kind of keep me on track. So if you see me looking to the side, it's I'm just reviewing my notes. The topic or the series, I guess, is going to be called the Patient-Provider Partnership. And this is a topic that I have been teaching on for probably 10 years. And I started by teaching in healthcare hospital situations. So to healthcare providers, perinatal conferences, continuing medical education credit coursework, grand rounds, university hospitals. Hi, Sarah, Sitara. Is that how I pronounce it? Hopefully, Sitara. You can tell me if that's right or wrong. So in teaching this topic, patient-provider partnership, to doctors, it's become very evident over time that there's a conversation to be had on both sides of this partnership. It really is a partnership between you and your healthcare provider. So there's a conversation to be had with medical care professionals so that they can learn the patient perspective of what a traumatic birth experience is about, and especially what that next or subsequent pregnancy looks like to the woman who's gone through that and her family. And then there's also a really important part of the conversation, hi Sarah, on the patient side. So this partnership that you have with your healthcare provider doesn't work unless you're both a big part of it. And so this is probably an hour and a half discussion when I'm teaching healthcare providers. So I'm going to break this into different smaller Facebook Live sessions. So today's sort of subtopic is going to be on the preconception appointment. We get a lot of posts about, I'm thinking about having another baby. What do I do? Where do I start? Is this going to happen again? What do I do? And you'll often see us post about the preconception appointment. And even, so we have anxiety, right? We have anxiety around even thinking about starting the journey towards a subsequent pregnancy. And then the preconception appointment can be its own anxiety piece. So, and there's a lot of there's a lot of pieces to put together in that puzzle for the preconception appointment. So let's talk about that a little bit. You can have a preconception appointment with an OB or midwife, depending on what your main healthcare professional provider is. We know in some areas I'm based in the US, and we know even in some areas of the US, a midwife may be, or a primary care physician may be your first or only even care provider. So this can apply to any care provider. Of course, we prefer that you're seeing an OB, a certified OB, at a minimum. And we know in some countries, midwife is the first person that you see, and occasionally then you're transferred up to OB care or higher if needed. So we understand that there are differences. Ideally, we'd have you all seeing at least an OB, but we'll do the best that we can and get you through. So, and you can also then have a preconception appointment with a MFM, maternal fetal medicine specialist. In the US, they're called MFMs now. You'll sometimes still see them called perinatologists. Overseas in Europe, they're often still called perinatologists. I do want to make that was my cat sneezing. I do want to make a point to explain that there are differences between a high-risk OB and an MFM, maternal fetal medicine specialist, or sometimes called perinatologists. To be an MFM or perinatologist, you have to have additional education and certification. In the US, the Society for Maternal Fetal Medicine are the ones who do the board certifications for MFMs. So a high-risk OB may be an MFM, but they may just be an OB who has maybe more experience dealing with high-risk pregnancies, or is more comfortable dealing with high-risk pregnancies than others. And there is a difference, though. So when we say see a high-risk OB, when we say see an MFM, we would really prefer you see an MFM or a perinatologist if at all possible. We know that's not always possible, and we want you to have the highest level of care. So if it's a high-risk OB without the MFM letters after their name, and that's what you can do, then that's great. Go with them. So you can have that consultation. Some of you are going to be searching for new OBs or new midwives, and even maybe new MFMs before your next pregnancy. So it doesn't hurt to have, it doesn't hurt to interview more than one doctor, to make sure you have the right fit. And in our next session, we'll talk a little bit more in depth about finding the right doctors, the right care providers. But today I want to just stick to this preconception appointment. So, but you can have the preconception appointment with your OB or midwife, and you can also have a preconception appointment with that higher level of doctor, the MFM or perinatologist. The first thing I want to mention, though, is insurance. So we have people from all over the globe here with varying levels of healthcare, whether you have a state-funded insurance like Medicaid, or if you're on the ACA healthcare, if you have private healthcare through an employer, if you have whatever kind of insurance you have, make sure you call and get approval if you need that to have a preconception appointment. We don't want you to end up with some huge medical bill because your insurance didn't cover it. And while it's important, this preconception appointment is important, try to go through the right steps first of getting approval with your insurance. Some insurances won't require any sort of pre-approval, and some will. So just check it out. And if you have issues with your insurance company giving you that pre-approval and it's necessary, come back post here and we'll give you some, some specific tips to kind of get around that if at all possible. Most MFMs are going to require you to have a referral from a doctor. Now, you may not have had a good experience with your last doctor, your last OB, and they may give you problems getting a referral. You can get a referral from your general care practitioner. Sometimes we have women who get them from their kids' pediatricians. There's a number of ways of going around. It doesn't necessarily have to be your last OB. It could be your new OB to get a referral to the MFM or the perinatologist. So just check. If you just cannot get a referral from any healthcare provider to a specialist and the specialist requires it, post here. We'll give you some tips about getting through to the MFM's office and to get around that referral requirement. Sometimes you can have conversations and provide information to the MFM and just let them know that you're having a really hard time getting a pre-approval or a referral to get into them. And sometimes they'll waive that. So insurance, get approvals there, referrals from your healthcare providers to get in to see the MFM. If you saw an MFM at the hospital that you delivered and you like them, it's a great place to start. They probably, have some of your records, and it's a good place to start. Otherwise, in the US, at least, you can go to smfm.org to find a maternal fetal medicine specialist nearest you. For those of you in smaller towns, you're probably going to have to drive to larger cities to find one. And that's okay. It doesn't, an MFM doesn't mean that you're going to have to drive there all the time to see that particular doctor. A lot of times they can manage your care from far away. So next topic on this preconception appointment. You want to be prepared for this appointment because it's going to be precious time. Sometimes it takes months to get in with a specialist like an MFM, and you just want to make sure that that you're all prepared. So the first thing, once you have an appointment set with the MFM, is to get all of your records transferred to the MFM. Don't trust that the MFM's office is going to make it happen. Make sure you're going to follow up on it. You'll need to get your hospital records from the hospital you delivered. There's probably going to be some sort of a cost. It's usually fairly minimal, but you'll need to do paperwork. At least in the US, there'll be paperwork that you have to fill out to allow a release of records. You can have those released to you or directly to your MFM. Sometimes it's cheaper if you send it from hospital to doctor versus getting a copy yourself. I know when I requested my medical records, they were very concerned, I think, about potential lawsuits. And so it felt like it was a little bit harder to get them myself. So definitely feel free to see if you can send them directly to the MFM that you have an appointment with. And you'll also are going to want your doctor records. So if you were seeing an OB or a midwife in your last pregnancy, the hospital will have records and the doctor's office will have records, and they will not be the same records necessarily. So make sure you contact your healthcare provider's office to get copies of your doctor's office records as well. Hi, Kelly. Hi, Jennifer. Hi, Crystal. Hi, Donna. Hi, Ashley. I don't know if hopefully I didn't miss anyone. Kelly, I had a preconception appointment prior to my second, which helped so much. Awesome. Yeah. They can really, really help, especially with planning and your anxiety levels. Having that preconception appointment can make a world of difference to many of us. So 3 steps so far: insurance, getting your referral from your healthcare provider to in order to get an appointment with a maternal fetal medicine specialist or perinatologist, and then getting your records and making sure they actually get where they're going. So you'll have to fill out the paperwork. You may have to pay a little bit of money to get them sent, and then make sure that you follow up with the MFM office to make sure they receive the records from both parties, the hospital and the doctors. If you had multiple doctors, if you had specialists, if you saw a nephrologist, if you saw a hematologist, if you saw a cardiologist, you're going to probably have to call all of those offices. And unless they are located within the hospital and the hospital has that information, just to make sure all of those records get transferred over. and then follow up to make sure they actually receive them, so that, and preferably in advance, so the doctor has time, hopefully, to look at them before he or she walks in the door to visit you. I had a fantastic MFM who, when I arrived in crisis at the hospital, who came in, introduced herself, and said, "Please bear with me. I haven't seen your chart." She pulled up a chair, she sat down, she opened my file, and she read everything. And it felt really good to me that she was, reading and paying attention, and that she was making decision based off of fact, really, rather than just what she was looking at. So some tips then from there is to be prepared yourself for that appointment with the MFM, to have questions ready. In our file section, we have a 2-page or page and a half list of questions. You can print it right from Facebook. Questions to ask MFM at Preconception Consult. Pretty easy. You can go down through the list, mark off the ones that are important to you. Maybe they're all important to you. Maybe you have additional questions on top of what we've come up with. And if you do, I encourage you to go to this file. It's open for comments. You can go in there and type in questions, and we'll go in eventually and update the sheet as we have people respond in there. So put your questions together, have them written, because we know every time we walk into the doctor's office, we're like, blood pressure cuff, and then we lose everything in our brain, right? So write them down, write your questions down. If you get in there and you're nervous, you're not sure if the questions are gonna be received well, if you're not sure if you can even get them out your mouth, hand this list, or whatever list you're taking, the highlighted ones or whatever, hand it to the doctor and just say, "I have questions. Can you help me sort these out?" The preconception appointment is the best time for these questions. They generally book lengthy appointments for the sort of meeting, and this is the time. So this is the time to ask all of the questions. Even if you think they're crazy questions, if you have a question, now is the time to ask. And it's a great time. Hi Dara, hi Heather. It is a great place to even let your doctor know that you're anxious, you're nervous, whatever you're feeling, and they can help you get through that. So again, this is the patient-provider partnership. It really is a partnership between you and your healthcare provider, and you owe each other certain things. They can't help you if they don't know what's going on. They can't answer your questions if they don't know what your questions are. And everyone has a different level of curiosity and understanding. If you get an answer that you don't understand, which happens, you can ask very simple questions. We have a booklet that we're going to release shortly that has a list of great questions when you don't know what to ask, really. Questions like, what does that mean? Because they don't necessarily know what level of understanding you have of what they've just told you. So questions like, can you explain that again? I didn't understand. What does that mean? Those are always great questions to ask if you don't really know what to ask. I know sometimes they tell me something and I'm like, I have no idea what they even just said. Like, I'm not even sure if that was in my same language. So it's okay. It's okay to not understand, and it's okay to ask for clarification. So if you, like I said, if you can't even get these questions out, or you're nervous, like I know sometimes I'm like, well, this question's a little controversial, and I don't want them to feel like I don't think they know what they're doing, but I'm still curious. I still have this question. Just hand them the list and have them go down the list of questions for you. That's what they're there for. So what else is on my list here? A great thing to bring along with your list of questions is a list of your current medications, if you are on any. On that list, you can have any diagnosis you've received in the past, so medications and the dosages. If you remember, that you were on certain medications during your last pregnancy, you can have that list together. And then allergies, things like that, of course, they'll go over in the paperwork when you first get there and fill out your paperwork. for the office appointment. But bringing in a list of meds to your doctor will help as well. I think there's one of the great questions on here is, are there any medications I need to change before pregnancy or in early pregnancy? So some of the medications you may be on are maybe not the best medication for pregnancy or breastfeeding or something like that, and they might want to change them early on. Some medications won't be as safe as others. And then there's some conditions like if you have thyroid issues, you may need to be seen early, or you may need to have a dose adjustment early on to make sure that you're staying healthy during your pregnancy. So do we have any question yet? Hi, Susie. It's just been me talking a lot, so I'm going to stop here for a minute and see if we have any. That's right, you genius. Satara, yay, I pronounced your name correctly. If we have any questions. Another topic that we'll kind of discuss in more depth on the next Facebook Live with the patient-provider partnership is expectations, your expectations for your doctor and your expectations for yourself. And, you know, I kind of liken this to when you mention something in passing to your husband and expect him to know that he was supposed to do something without, being direct. So we'll talk again a little bit more about expectations you have for your doctor and having that conversation directly so that you're all on the same page. But one of the other things with expectations is a lot of times we get people posting like they didn't like their doctor, they weren't friendly, they didn't have a good bedside manner. You are not hiring your doctor to be your friend. If you find a doctor, like, of course you don't want them to be a jerk, right? But you're hiring scientists, doctors, their brains work differently than most of the rest of the population, scientist brain. And you are hiring your doctor because they're good at what they do. You're not hiring them to be your BFF. And I honestly don't care if my doctor has a good bedside manner. You're hiring them because they're skilled. And there are things you can check to make sure that they're just being doctor nerds and not, meanies. But things to consider are they listening? Are they making eye contact? Are they taking notes? Do you feel like they're, answering you in a genuine manner? Those are great items to think about when you're having conversation with them if you're not maybe necessarily pleased with their bedside manner. Maybe they just had a bad day too. Let's see, Satara, I have a bad habit of becoming completely suspicious of an MFM if they say something that goes against current recommendations, even something small. Is there an appropriate way to navigate that? It's probably not fair to write them off completely. Right. So our standards of care, I don't know where you're located necessarily, but in the US, we have the ACOG Task Force on Hypertension. They are guidelines. They were issued in 2013. It takes a really long time sometimes for those guidelines to trickle down through hospital policies. And some of these doctors have been doing things a certain way for a long time. It's hard to change habits. Some of them are privy to research that the rest of us aren't. And so they, may make a recommendation that is a little different. This syndrome, this disorder is a syndrome. It's caused by many different reasons. We all know that it stems from the placenta, but the reason, our placenta is having issues happens for a number, hundreds of different reasons for each of us. So these doctors are treating the patient. There may be something in your chart that makes them want to do something differently. And it's okay to question them. I would definitely not write them off completely. It's okay to question them. Take the ACOG Task Force on Hypertension is in our files as well. It is 100 pages. So I would suggest you print off the section, perhaps, that is on the topic that you're having issue with. And we even have a file that is like our most frequently cited ACOG guidelines. Print that section off and just say, hey, I want to be an active participant in my care, and I've read, X about this issue. You're recommending something different. Can you explain that to me? Can you explain why you're doing something different than the ACOG guidelines? Again, they're guidelines. Your doctor's treating you a patient who may have a different, your chart may say something different to that doctor, right? And just have that conversation. If you do it in a respectful, inquisitive way, they won't, they won't think poorly of you. They won't be upset that you're questioning them. Well, I guess some might, but just make sure you're asking good questions. If you print out the documentation to have with, so that you can point to it and quote it, and just have a conversation. It's okay to ask questions. Just do it in a manner that's inquisitive, not accusatory. Because again, they're treating you as a patient, and they may have a very good reason for what they're doing. Hi, Cheryl. How are you? Is that fair, Satara? Great. So let's see. What do we have? Let's go over some of these questions. That are really good to ask. So we've broken these down into before pregnancy, during pregnancy, and sort of delivery type questions. Before pregnancy. So the first one on here makes sense. If you have any questions, this is a great time to talk about your past delivery. So if you don't really know what happened, this is a great time to discuss it. You can ask about pathology reports on your placenta, and just ask the good doctor what your history, what your records mean to them. What do they think about all of that? Satara, thanks so much. It can be hard not to be fragile and overly nervous after a loss. Yeah. And it's that way whether you've had a loss or not. And certainly loss moms are at a much heightened level of anxiety and vulnerability. It is a very vulnerable position, and that's something that I talk to the healthcare providers about, is about our vulnerability and our need for information. In decades past, it was, we weren't really told much information. We didn't know much information. Women who lost babies were told to, forget about the baby and move on. And we've learned that really education is the key to successful outcomes. So if you're educated about this disorder, if you're educated about your body, if you're educated about what's normal and what's not normal, and you have those tools, the information, research as tools in your back pocket, and you can advocate for yourself that way. It's hard to advocate and just say, well, I think, but if you have the guidelines, if you have, that information that you can bring to your physician's attention, it's easier for you to advocate for yourself and advocate for your baby. So, and absolutely we should. There is a way to go about it that, will likely get you the outcome that you're seeking. And really that it's that education and knowledge piece. So, great time to talk about your past pregnancy. This is, a lot of times when you guys post questions, we'll ask you historical information. So we'll say, well, what gestational week did you deliver at? Did you get steroids? Did you have chronic hypertension? Did you have gestational hypertension? The answer to your questions are all going to be different based on your history. So it is a great time to discuss what happened in your past pregnancy to help have an understanding of what may happen in your next pregnancy. The preconception appointment with your maternal fetal medicine specialist, they'll give you a personal risk factor for your chances of developing preeclampsia, HELLP syndrome, eclampsia in the next pregnancy. So the great thing to know is Once you've had a hypertensive disorder of pregnancy, yes, you are at a greater risk than someone who hasn't had one in their first pregnancy or their previous pregnancy of having it again. And yet, statistically still, preeclampsia, eclampsia, HELLP syndrome happens in the first pregnancy the most. So knowing certain things like the week that you delivered, if it was before 34 weeks, you're more likely, your risk factors are probably going to be a little bit higher. You may have an underlying that needs to be sorted out. So your placenta pathology may give the doctor some insight into tests that need to be run. Your health after that delivery. So anything in that 6-week postpartum period is sort of, pregnancy hormone related, and you get that time. Once you're past 6 weeks, things change a little bit. They're going to want to know if your blood pressure has continued to be a little bit higher, even if it's not sky high. If you're above 120/80, you may be considered chronic hypertensive going into the next pregnancy, and that's okay. You didn't cause chronic hypertension. It doesn't mean that it's bad. It's just good for the doctor to know so that they know how to treat you appropriately in the next pregnancy. If you've had an abruption, if you've had a C-section or other complications, this is a good time to talk about those things and how they impact a next pregnancy. If you've had a classical incision or a T incision, your doctor may want you to wait longer before your next pregnancy so that you can heal appropriately. And then, of course, the biggest question, what are the chances of this happening again? And your MFM is the right person to tell you this. So my preconception appointment, which has been a long time now, was 2 parts. So I went in, they had reviewed my records, we talked about what happened, which was very cathartic and healing, I would say. Some people are really nervous about it, but it was a good experience for me. I happened to see the partner of the MFM who took care of me in the hospital, and that was great. From that information that they gather from your last pregnancy, they'll decide if there's any testing that needs to be done. So the next question is, are there any genetic or other tests I should do before pregnancy that might help with identifying and treating an underlying condition? So we get people, women come on and they want to know every single test they could possibly be tested for, so that they can tell their MFM which test to test for. Your MFM probably knows which test to test for, and you don't need them all necessarily. So things about your past history, things about your pregnancy will tell them what ideally they should be looking for. We get this a lot with the clotting disorder tests looking for antiphospholipid antibody syndrome, and things of that nature. There are specific criteria in pregnancy for some of these blood clotting disorders. And so if you delivered after 34 weeks or after, they're probably not going to test you for APS, because in most situations, unless you're being treated somehow prior to that, it's not likely that you have APS. That's just some of the criteria. So they are looking for certain things and they went to medical school, a lot of years of medical school to figure all this stuff out. So they know the subtleties and the differences in what happened to you and what they should look for in, for underlying disorders specifically before your next pregnancy. Low-dose aspirin. So I think there's like 30 or 40 aspirin studies going on right now. Something like 12,000 women, I think, in aspirin studies. We're going to see a lot more in aspirin. The ACOG recommendation at the moment is to start, for certain women, to start, that's my cat meowing in the background if you hear him, to start aspirin in late first trimester. So we interpret that to mean before 13 weeks. Some doctors are going to have you start it preconception. Some are going to have you start it after 10 or 12 weeks. Some are going to have you go all the way to, week 12 before they have you start it. Doses are going to be different. 81 milligrams in the US. In some European countries, it's 75 or 150 or 162, we're going to see doses continue to change as well as some of the new research comes out. We're seeing some research that chronic hypertensive maybe don't benefit so much from aspirin in pregnancy, but maybe they do if they take it prior to conception. These are all just studies right now, and our only advice to you is to talk to your healthcare provider about whether aspirin is right for you or not, and work with them to determine what dosage and when to start it. We have a lot of people who want to self-treat. They want to do something. They want to do something to prevent this. You didn't cause it in the first place. Nothing you did or nothing you didn't do caused this. So trying to prevent it on your own is not a great idea. And it's part of this patient-provider partnership. We have people who take supplements or are doing things or not doing things that their doctors have told them to do because they have an opinion about it. They have a belief. They want to do something. And it's not fair to your doctor. And it's not really fair to your health, your entire health care plan if you're not honest with your doctor. So talk to your doctor about what's appropriate for you. Some of us should be taking it. Some of us shouldn't. Some of us should be taking higher doses. People with asthma, sometimes certain things can cause more side effects. So talk to your doctor before you self-medicate with anything. Medications, we talked briefly about that. There may be medication changes that you need to make prior to conception. Now, here's the thing. Some of us have fantastic plans to have preconception appointments, and then, oops, we're pregnant before we can have that preconception appointment. You can still have we can still have an appointment with the MFM. It's just going to be a little bit different. Some of the tests that they would normally do, they wouldn't because the results aren't going to be as accurate once you have pregnancy hormone swirling. It's still okay to have that appointment and discuss what happened in the past and what the plan is for the future. So if you do happen to get pregnant before your preconception appointment, just get on the phone and let them know, and it'll just change the course of the conversation a little bit. Anyone with questions can feel free to pop in whenever they like. We won't go too much longer. Questions, great questions to ask. Who do I call when I'm having an issue? Do I call the OB? What's the phone number? Is it the regular phone number you call? Is there an answering service? What can you expect for turnaround on returning that phone call? If your OB office or midwife office doesn't have an after hours line, who do you call? Do you call the hospital? Generally, hospitals are going to tell you to come in. They don't know you. They don't have your chart. They don't want to make a decision on your healthcare based on a phone call. So it's just good to know what your doctor prefers for you to do if you're having an issue outside of normal business hours. Talking about who's going to see you, who's going to oversee your care. Are you going to see a midwife who has an OB that they consult? Are you going to see an OB? Do you have an MFM on board, a perinatalogist on board who's going to oversee you? Are you going to see the perinatalogist exclusively, which does not happen very often? Just so you know, it's not common for a perinatalogist to oversee your entire, like all of your prenatal appointments. Occasionally, we have some women with really rare autoimmune disorders that do see the MFM for all of their appointments. But just have an understanding of the chain of command and who is your point of contact. You can ask questions like when your first appointment will be, if they're going to do baseline labs, baseline 24-hour urine. I always recommend the baseline 24-hour urine. I'm not a doctor, but I recommend it to you. I'm one of those people who never tests positive on a dipstick for protein, and yet I spill probably 400 milligrams on a given day not pregnant. And so it's important for my doctors to know that I spill protein outside of pregnancy. They don't have to get too excited about it until I hit a pretty high number in pregnancy. Talk about testing. What kind of plan for your care? Ultrasounds, visits. Are they going to see you more often? When are they going to see you more often? We get a lot of posts about, I'm 14 weeks and my doctor, won't see me again until 4 or 5 or 6 weeks away. As awful as it is to say, there's not much that can be done before 24 weeks. So yes, you should have glucose testing at the appropriate time. Some people that'll be really early on if you've had high glucose numbers in the past, or borderline if you've had gestational diabetes in previous pregnancies. If you have a history of diabetes, they may be testing you really early for gestational diabetes. How frequently are they going to see you as the pregnancy progresses? When do those appointments increase? If your MFM is a long way away, for a lot of you who are more rural, that's going to be the case. Is there a satellite office where you can do things like blood draws and monitorings and things like that that can be done in advance of your appointment so that they have the results already, rather than you having to wait, drive all the way there, have the appointment, and then wait for results and potentially have to go back. Talk about whether you need to monitor your blood pressure at home, when that should start, how frequently. We have you guys come in here and post and say that you're taking your blood pressure 15 times a day. That is excessive. You don't generally aren't going to need to take it that often. So, and we know that taking a blood pressure at home can increase anxiety for some of us. So let's do it in a way that is going to be beneficial and not just freak us out all the time. So have that conversation with the doctor. One side note I want to mention, at least in the US, and this may be true in other countries as well, if you are, especially in a rural area, your pharmacist, your local pharmacist, is trained to use a blood pressure cuff. And I'm not talking about the automated machines in the pharmacies or the drugstores. I'm talking about an actual manual cuff behind the prescription counter. Your pharmacist, your local pharmacist, can often take your blood pressure for you. So it's always worth noting that you can stop in at a pharmacy and ask them to take your blood pressure. Also, fire station and police stations generally have a medic, or they're trained to take blood pressure as well. And I know for sure in the US, if you stop in at any fire station, the EMTs or the trained firefighters will take your blood pressure for you as well. So if it's something that you just can't do yourself, or you've gotten some high readings but you're not sure if they're accurate and you want to gut check before you drag 2 hours into the hospital, or you go to sleep for the night and you're worried about it, feel free to consider stopping into any of those places to have your blood pressure checked. Any specialists that they want you to see. So some women who've had cardiomyopathy, or they were on dialysis after the last pregnancy, they may want to be seen by a specialist if they're not already being seen by one. But it's reasonable to have a discussion with your specialist, your cardiologist, your nephrologist, your hematologist, your endocrinologist, about any concerns they have for you getting pregnant next time. I would, just a side note, say let your MFM make those final decisions. They'll work closely with your specialists. Your specialist, your nephrologist, isn't necessarily a high-risk pregnancy specialist. We do have some that are, but work with let them work together, let them talk, before ruling anything in or out. When should you call for concerns? This is the best question. What is that high blood pressure reading that deserves a call in? Say it's midnight on Saturday night and you get a high reading. What is your threshold? It's going to be different for everyone. For chronics, it's going to be a lot higher than for those who end up with gestational hypertension. What is the blood pressure reading that is, don't go past jail and go straight to the hospital? Find out, ask what that is. And you don't necessarily have to ask it at this first meeting. These questions are great to keep with you for your regular appointments, but find out what number, because you're coming in here at 3:00 in the morning and saying, my blood pressure is X over X. What should I do? Should I go to the hospital? You need to, if in your gut you feel like you need to go to the hospital, it's always appropriate to go to the hospital. But if you ask in advance, at least you'll have that number and you'll know what blood pressure reading is really worthy of a call or worthy of a trip into the hospital. Ask about what hospitals they have admitting privileges to. Where would you deliver? Where's the nearest level 3 NICU in case you would need it? Do they have permission to work there? That all helps you sort of build your confidence in your care plan and what's going to happen, because we all want control. We all want control over what's going to happen, and yet we have very, very little control of what's going to happen. The things we can control are information and education, educating ourselves, asking good questions, and in understanding our care plan. Hi, Elizabeth. Hi, Jessica. Also, medical stats aside, if you feel terrible, then do something. Absolutely. We would rather you go into the hospital a dozen times in a week than to have you sit at home and have something terrible happen. So you'll see a lot of times people will post in the group, and generally the first response is an admin asking questions, right? We're asking questions because we're trying to determine, for some people, when they report certain symptoms, it's just somewhat normal because they're chronic hypertensive or whatever. And then some people can report the same symptoms and it can be a completely different scenario. So we get, you'll see us kind of cut off posts when we've got 12 people who are saying, go to the hospital right now. Well, yeah, it may be a go to the hospital right now situation, but a lot of times there's a couple of questions that can be asked to determine, whether it really is get out of bed, drag your kids out of bed and get to the hospital, or can it be handled by a call to the doctor? But definitely, if you feel like you need to go to the hospital, go. We have a lot of posts from people who are like, I feel terrible, and we're encouraging them to go in, and they're like, well, it's just really difficult for me to go in, so I'm going to stay home. And we're like, just go in. And then we, the opposite as well. Like, I'm freaking out. Should I go in? You're like, you have to trust your own instinct, right? You have to trust your gut. If you think you need to be seen, and don't wait around. And you don't need permission from us. We like to give you permission, but we're not always around to approve those posts in the middle of the night when you're not feeling well. So just go in. It's always worth going in. And then you can ask about steroids and things for preemies, especially if you had a premature infant, or especially premature infant. It's good to talk about NICU. VBAC, so vaginal birth after cesarean, is a big topic around here. ACOG encourages VBAC when possible. So that's a good conversation to have with your healthcare providers as well. Some healthcare providers just don't do them. And sometimes that's because maybe the hospital they have isn't equipped to handle an emergency. And, then it's a decision for you. Do you go to a different doctor that goes to a different hospital? Do you have to go farther away to have a VBAC? And what's really, most important to you? And we just want you to have a healthy birth, whatever that looks like. So it's a good conversation to have. If you really want a VBAC and your doctor doesn't do them, if it's otherwise safe for you to have one, then, it may be worth you seeking care from another provider. Now, if it's not safe for you to have a VBAC for whatever reason, then, then you should trust your doctor's judgment on that as well. And don't let others dismiss it as normal pregnancy feelings, especially if it's your first. Yeah. So preeclampsia, is a great pretender. A lot of normal pregnancy symptoms are very similar to preeclampsia. So there are some subtle differences in a lot of things. And so, again, that's why we ask a lot of questions. So especially in swelling posts, swelling is not a diagnostic criteria anymore. And however, it does show up in some of us. So swelling in your feet, especially in the summer, swelling in your hands after 20 weeks, especially all normal. Pitting edema can be normal. And yet if your eyelids swell up overnight, if your swelling gets worse rather than, a little bit better overnight, those are definitely, reasons to be seen. And it's always okay to call your doctor if you're not sure. You don't necessarily have to pick up and go to the hospital, but if you're concerned, call your doctor. If you find yourself overly concerned, which I'm just going to say, everyone has a complete right to be anxious, to have anxiety, and I think our population is probably highly under diagnosed for anxiety, post-traumatic stress disorder, depression, postpartum depression, and other things. I encourage everyone to seek help on this. If you are just anxious going into it to start, have that conversation with your doctor. Have a conversation about birth trauma therapy. Going through traumatic birth does a number on you. I waited 8 years to seek therapy, and while I did some great things in those 8 years, my life certainly could have been a lot better had I sought therapy first. So therapy and medication. Oh, you can see my cat. He's trying to get into the picture here. Medication can get you over the hump if you are freaking out, if you're having anxiety, if you're having panic attacks, if you can't stop thinking about your blood pressure or something bad happening. These are all reasons to talk to your healthcare professional. If your healthcare professional, and I'm talking like your OB, is dismissive of your anxiety, then you might have to say, hey, you might have to get serious and say, hey, I'm anxious and I need to do something about this. I can't cope with this. I need a referral. If your OB won't refer you, which is unlikely, your PCP can refer you, and oftentimes you don't even need a referral for counseling at a minimum, and your counselor then or therapist can then refer you to a psychiatrist if you need to add medication. People don't want to take medication in pregnancy because they think it's bad. This anxiety, panic attacks, the excess cortisol running through your body when you feel that way is also not good for you or your baby. So this is a risk-benefit analysis here. Those things aren't good for the developing baby as well. A happy mom is going to be a much happier baby. So we need people, it's of course totally normal to have these feelings after you've been through a traumatic birth, and there are ways to help you feel better as you start your journey to your next pregnancy or during your next pregnancy. And we want everybody to be happy and healthy. So I don't see any other questions at the moment. I will come back to this video and answer any other questions that people post as they get a to get around to watching this. I know some of you are fast asleep on the other side of the globe. Katie, hi Katie. So thanks, Kara. Very useful to hear you talk so calmly about the questions thrashing around in my head. Yeah, a lot of the group moves pretty fast. We have a lot of posts coming in, 30 to 60 a day often. And a lot of times it's after work and after we put our kids to bed that we're answering. So the answers are, questions and answers are coming quickly. And it is nice to put a face to a name. I know that. We deal with the moderators and the admins. We've been doing this for a really long time. So we've seen all of this, and we've, kind of have best practices on a lot of this. So I'm glad that you find it useful. I'm glad my voice is calm and that we can sort of have these discussions. I'm glad my cat didn't completely walk over my keyboard and shut down the Facebook Live. I would love to also hear what other topics you'd like us to talk on. We have Crystal Waddell is our labor and delivery nurse, who's also an admin in the group. She's going to do a Facebook Live on breastfeeding and pumping. She's a certified lactation consultant. I think that's her certification. And she's been a labor and delivery and baby nurse for a long time now. So she's going to do that. We're going to have one of our medical professionals on in the months ahead to talk about cardiovascular disease. And then we're going to do maybe a series on mental health around, and we've done one in the past. There is, if you're interested, we do have a Facebook Live session called Ask the Therapist that was recorded a number of months ago, but it's still very relevant if you have questions about anxiety or postpartum depression or PTSD. It's a great talk with Nicole. And our next discussion on the patient-provider partnership is going to be really getting into how to choose your doctor. Now you've had a preconception appointment. Maybe maybe you didn't sit well with you. Maybe the MFM you visited or the OB you had an appointment with wasn't the experience you thought it was going to be. And if your expectations are, managed well, then perhaps it makes sense to have get a second opinion. And then from there, how to pick the care provider for you, and then how to have healthy conversations with your doctor. What kinds of questions to ask in more depth, really on being honest and truthful with each other and setting that expectation. We have a lot of people who post and say, well, I don't know if they're just saying that to make me feel better. I don't know if they're telling me the whole truth. Well, ethically, they can't really keep things from you, and yet there are great questions you can ask to make sure you are getting the full truth. I remember specifically when I was admitted, the doctor said, well, you're going to be here until you have the baby. And I thought, oh, well, I'm, 9 weeks, it's 9 weeks until she's due. So assuming they'll deliver me a couple weeks early, I'm probably here for a good 6 weeks. And that was just a conversation that went on in my head. I thought, okay, well, I can do this for 6 weeks. No big deal. My husband had the sense to ask, when do you think that will be? And the doctor said, probably within 48 hours. And, our lives kind of turned upside down at that moment. And yet we had time to process and prepare versus, getting 36 hours in and going, what do you mean we're going to have a baby in 12 hours? So we'll really talk about trust, having a relationship with your care provider that centers around trust, because with our anxieties over what has happened and maybe some betrayals or what feels like betrayals from our past care providers, trust is something that we are lacking and is hard to find, and ways that we can have conversations with our care providers so that we can trust them to do their jobs, and they have to be able to trust you as well. So having a good relationship with them is what we'll talk about next time. So again, any topics that you'd like us to talk on, it doesn't have to be me. We have a bunch of really smart people in this group. Almost all of them are smarter than me, and have different sensibilities and different specialties. So any conversations that you'd like to talk about, let us know. Post them here, post them in the main group, and we'll start planning some sessions around them as well. I will try to do this next session on the patient-provider partnership around trust and conversations with our doctors next week. And I'll try to get it posted so you guys can plan for it. Today was just kind of, I had makeup on and decided to do it. So thanks for watching. Thanks for all your great questions. April, thank you. Oh, thanks so much. Yeah, we can definitely have a discussion about chronic hypertension, superimposed preeclampsia on chronic hypertension, for sure. And thanks so much for being a part of this group. Our hearts are just filled with everyone in this community and all that you do to support each other, and make this a place where I think we will continue to have better outcomes with preeclampsia until until we have better research that helps us get farther along in our pregnancies, this is the place for us to grow, and for the medical community to grow and understand where we're coming from, and vice versa. So healthy, good outcomes is our goal here, and we couldn't do it without every single one of you. So we thank you so much, and we'll talk to you again soon. Okay, have a good day. Bye.